moves in that direction. I'm pleased to have a variety of wonderful, committed public servants to talk to you, to talk with me about how our communities are responding to the COVID-19 challenge. Unique because, as well as having State Senator Jeff Hayden, who represents District 61 in South Minneapolis, on board, we ought to be being joined by State Senator Bobby Champion, hopefully within the next few minutes, who represents North Minneapolis Senate District 69, and another leader in healthcare in Minneapolis and Minnesota, Stella Whitney West, CEO of North Point Health and Wellness Incorporated. And so the final thing is we hope to be joined by Representative David Bowen, who represents the 10th District of Milwaukee in the Wisconsin State Legislature. Yesterday, when I was watching, like all of you have been, CNN to get the updates on our community and COVID-19, I saw a wonderful interview with Representative Bowen, who talked about the particular impact of COVID-19 on a community of North Milwaukee, population heavily African American and Hmong, and that struck home because our community, North Minneapolis, South Minneapolis, St. Paul, African American, Hmong, Latino, communities of color. So hopefully Representative Bowen will join the call and we'll have a conversation about two states and about our country and about how institutions and individuals can all be responsible in addressing the question of the coronavirus. Let me ask, is Representative Bowen on yet?
No, you're not.
He's not. Okay. There is Harry Colbert, managing editor of Insight News. Harry is engineering the event remotely. And Harry, thank you. Harry, you've got an article in yesterday's paper that sets up this conversation. You talk about the sort of experience in Black America, the impact of COVID-19, and particularly how our community is not being discussed, but we have tremendous impact that we're experiencing. What about that, Harry?
Well, I don't, what occurred to me is in my Facebook timeline, and as I said it when it occurred to me, my timeline is probably jaded because most of my people who I interact with are African American. So of course we're going to be sharing news that we feel is germane to us. But what I kept seeing was being shared from news outlet after news outlet in other cities, whether it was Milwaukee, Detroit, St. Louis, Atlanta, and so on and so forth, were the faces of the victims of death to COVID. Now, when they talk about COVID, they say 80% of the people who get it will have mild to no symptoms. 20% will have serious symptoms. Of that 20%, 5% will be in ICU. Well, what I kept seeing were Black faces that were dead. So I began doing research, and what I came up with, the first thing that I came up with was a story out of Milwaukee where they were saying, and I think this was this past Friday, there were 14 deaths in the state of Wisconsin due to COVID. Of those 14, 8 were African American. And that comes out to 57% in a state that's only 6.7% Black. So clearly there's an anomaly there. We were seeing similar anomalies in Detroit, and then also in Milwaukee just days prior to this in February, I believe 26th, the the government there had put forth a proposal to address the specific health disparities when it relates to African American people. So they already knew that there was an issue. Last week, I interviewed Dr. Danielle Lee on Zoom as well, and she's a noted STEM scientist. And one of the things that she said is this pandemic is going to highlight what has already been known, but it's going to put a red hot spotlight on it, on the fact that there are disparities in healthcare when it comes to Black people, people of color, people with accents, and people with disabilities. And they said, and she said, if you have multiple of those, then you really have a heightened disparity there. So that's kind of what this article delves into, and it's on our Insight News page at insightnews.com and on our Facebook page.
Harry, thank you. I'm Al McFarland. This is Conversations with Al McFarland, a special broadcast today. We are operating remotely from the studio, so we're doing two things, carrying the broadcast on radio as per usual. And let me remind you that this is Pledge Week. Today's program, like other programs this week, programs intended to invite you to support KFAI, support programming like this. And if you are interested, if you are able, if this programming, this conversation means something to you, we invite you to support it by going online to kfai.org and pledging your support. Do that right now. I'll be asking you that over the course of the hour. Stella Whitney West, before we go to policy and Senator Jeff Hayden, I wanted you to talk about the ground level, on the ground. You support and serve a community that I live in North Minneapolis, where our office is located. You have the premier health resource in our neighborhood and community. How does it look from where you are? What kind of changes are you discovering already in terms of services that you're delivering to people in the community who depend on North Point Health and Wellness for both medical services and mental health services, food support, things like that? What do you think, Stella Whitney West?
Well, thank you, Al. I hope you can hear me.
I think we hear you well.
Okay, so you're right. In Health and Wellness Center, we are a federally qualified health center, a community health center. We've been in North Minneapolis for 52 years, providing medical, primary care, behavioral health, dental. We have an on-site pharmacy. We have an on-site laboratory. We also provide social services through, we have a food shelf. We also provide assistance with housing, employment as well. So we certainly had to revise how we operated based on a couple of things. One was that there was just a shortage of, people have come to know this term, PPE, personal protective equipment. And for us, that's our lifeline. Those are the masks, the different type of masks, those are the gloves, all of the equipment, apparel that our healthcare workers wear in order that they are protected, but also that the patients in the community and the community members that we serve are protected as well, so that there is no transmission of viruses or any type of contamination. So we first became aware of that in January, kind of like late January. All of our suppliers were telling us that due to the coronavirus outbreak in China, that they could not fulfill our orders. And so we started to get concerned when it was supplier after supplier was telling us that, and there were these back orders and our supplies started dwindling. And then, of course, as the number of cases started increasing across the country, and then here in Minnesota, as most of you know, we are also affiliated with Hennepin County. Hennepin County then declared their state of emergency, and we went into this incident command structure, which I am a part of, North Point is a part of, and we're able to share in the county supply of those PPE. So that has relieved some of the pressure, but not all of it, because it is a shortage across the country. So we are still operating, we're open, our plan is to stay open. We've reduced some of our hours in order that we can continue to stay open. And some things have come where we had to restrict the type of procedures that we do. So for example, in our dental clinic, the Board of Dentistry restricted all dental procedures only to emergency procedures. So we're only allowed to do emergency procedures. So, but our goal is to stay open.
Let me ask you, can you hear me okay, Stella?
Yes, I can.
So I got a call this morning from one of your team members thanking me for a contribution that I made personally as a resident of the community to support the North Point food shelf on Plymouth and Golden Valley. I think it's wonderful that the food shelf is there. But I raised the question, in the past 2 weeks, this was a donation that was made a month ago, maybe, right, in the campaign. But it occurred to me that this food shelf is going to be under tremendous pressure based on the economic challenge that COVID-19 is having. People are not working, no paychecks, no jobs. And so she told me that in the past week, you've had a 60% increase in use of the food shelf, and that represented people that were not historic registered users, but new people. Tell me about that. And I shuddered at the thought of as this program rolls on, as this pandemic rolls on, what's going to happen to our community and how you might be overwhelmed in trying to support our people.
So first of all, I want to say thank you as well for making the contribution to the food shelf. And I would say that what we are seeing, what was reported is correct, somewhat correct. I wouldn't say that we're seeing a 60% overall increase. What we're seeing is a 60% increase in the number of new people who are coming to the food shelf, because we started noticing that, and you're right, it's a direct correlation to those folks who have been laid off of their jobs, and so are coming to the food shelf in order that they can make ends meet. We have been fortunate in that we have gotten donations, not only from the members of the community, but also we received some donations from a couple of foundations, and also we've received donations also from our staff and others. We still need more. There's no question about it. We are currently in our food drive. And so all food shelves in Minnesota are in the food drive. It goes through April 30th. So I encourage people, they can go to our website, which is www.northpointhealth.org, and there's information on there on how they can make a donation to the food shelf. So we also had to change how we distribute food, again, making sure that we are our staff as well as the public. So we changed it from like a food choice distribution to more of a pre-package, and we are able to give people a pretty substantial supply of food based on their family size.
Great. Well, Stella Whitney West, thank you so much. Stay with us if you can, but if you have to leave, we understand. I wanted to switch to Senator Hayden. And Senator, two things. One, a review, if you would, what's happening on the policy level with the legislature. Our governor and you and the legislature have moved, I think, fairly expeditiously to create a financial response and a policy response, but maybe you would give us an update on what that means right now. And let's have a discussion about what the voters, the community, the consumers, the residents of our community need to do, how we can be proactive and play our role. And part of that is how we individually handle things like social distancing and beyond, health hygiene. So Senator Hayden, thank you for your leadership. First of all, thank you for being here.
Well, thank you again, Al. Once again, I'll be here as much as you need for me to be here. Quick update, because I think it's important. Today, just got the information out today. 629 confirmed cases. That's up from 576 of yesterday. We've confirmed 2 more COVID-19 deaths for a total of 12 in the state. Age range is from 4 to 104 years old. Median age is 46 years old. Since the start of the outbreak, 112 COVID-19 patients in Minnesota have been hospitalized. The rest of the patients have been recovering at home. There's 56 patients currently hospitalized, 26 in intensive care, and as of today, 288 patients have recovered enough to be released from isolation. This total of 629 lab confirmed cases reflects only results from the laboratory testing. There are more cases in Minnesota. I always like to start with that just so that we can understand what we're dealing with, that we are still heading up. We hope that the curve doesn't spike like it is in some of these other cities that we're watching each and every day, but we still are increasing cases, and there's a lot of reasons for it. Want to reemphasize the shelter-in-place conversation. That really means that as much as possible, be at home. There, you can go take a walk or take a bike ride as long as you're kind of distancing, I like to call it physically distancing yourself from people in order to get some exercise. You certainly can go to the local pharmacy to get your pharmaceuticals. Go to the clinic if that's what you need to do. I advise to call so that you don't overwhelm that, and that Stella and her crowd can be ready for you. I would also emphasize people that they should go to the grocery store, but most responsible grocers are only letting a certain amount of people in the store at a time, and that they also have the distance in place there. I know I went to the club the other day. They got a big plexiglass screen to try to protect their workers. That's important. So I want to say that we can still do things in this society, but what we're trying to do, think of it like this. This is an organism that's looking for a host, right? It's a virus, it's an organism. And if we can make it hard for that organism to find a host, that organism dies. Want to re-emphasize washing your hands and using hand sanitizer when you can. Washing your hands are the best, but if you are mobile or in a place, use the hand sanitizer. And then at best, and I know it's hard because even for me, my mouth gets a little chalky, to don't wipe your face in your mouth unless your hands are really clean. That is it. Those are the things that are going to help to drive down this issue. If you are taking care of loved ones, and Al, you talked about some of the underlying health conditions, you've made that public. So your family, if they come to see you, you're raving at your grandbaby through the window. If your daughter's bringing you and your wife food, they made a meal, they're leaving it at the doorstep so that you don't have to interact with them. Because remember, young people can get it, and it can be very critical for them. But often people in good physical condition sometimes are asymptomatic, or just feels like they have a cold. But that for you, and I've got a lot of gray in my beard now. Stella, I know you're still pretty young, but for us, that could be a much bigger problem. So it doesn't mean that and I would encourage us to call each other, talk to each other, FaceTime each other, Zoom each other. My mother lives in San Francisco by herself. She has a great church family. I call her every day. My father is still running Turning Point, but he's running it out of his home because he's in the hot zone, but his great staff are still doing work. But check in on them, have those conversations. There is, and I know Stella can talk a lot more and a lot more articulate than me, we do not want to get into an isolation situation where mental health issues start to arise, and then we got a different problem. And then the last thing I will say, and we can talk about the appropriations and others that we're doing, but one of the things that emerged, I just got off a call with the Lieutenant Governor and the People of Color group just before you, and one of the things that emerged is that half of the police calls this weekend were for domestic violence. So I'm going to say that again. Half of the police calls were for domestic violence. So that says to couples and people living together, have some patience with each other, figure out how to love each other, recognizing that we're all in this together. And then for other people who know that they may have family or friends or others that are in those situations, that system is available for people in that situation to go to. or if there's opportunity for you to figure out places to go, please check in on them. People become very isolated at this point, tempers flare, or if you are in an abusive situation, this is a way in which like it could flare up because you're not going to work, finances are getting tighter, substance abuse probably is going up, liquor, there's a double-edged sword on keeping liquor stores open. On one sense, we don't want people to start drinking to a point where they, fall off the edge. At the same point, one of my doctor friends who's a senator said, for those that are in an addiction and are still drinking, he didn't want the beds to be filled up with withdrawal symptoms, right? So there's a double-edged sword to that issue, but please watch, your kind of create a routine for yourself. Think about, sometimes if we go to a bar, we say, I got $20 to spend, that's 2 or 3 drinks, but that's a bottle. And you look up and you might drink the whole bottle and then you got a whole different situation.
Right.
So I just want to make sure that we're bringing this to the ground floor of what we need to do to be able to take care of ourselves. And now I can answer the appropriation question and the larger policy questions, but I at least wanted to get to this.
This is great. Thank you, Senator Hayden. Let's unpack some of that first, and then we'll go to the appropriations. But in doing the unpacking, we'll ask Stella Whitney West to join. And Harry, you can also let us know if either Senator Bobby Champion or if Representative David Bowen are able to join us from Wisconsin.
Representative Bowen, I got a text message saying that he's attempting to join, so hopefully we'll have him.
Great. Well, when he's on, we'll just bring him into the conversation.
Yeah, Senator Champion will not be able to join.
Okay, thank you for checking it out. And so you're listening to Conversations with Al McFarland. I'm Al McFarland. Special program today. It's unique because we're doing it remotely. I'm operating from my home in North Minneapolis. Harry Colbert is engineering from his home in North Minneapolis. We have on the phone Senator Jeff Hayden, who represents Senate District 61 from his home.
And I'm operating from my garage.
From his garage, right in South Minneapolis. And Stella Whitney West, now you might be at work, Stella. I'm not sure if you're at work or if you're at home.
I am at work, but I am working remotely today. This is my first day working remotely. Have been going, and my energy level got low. And I said, you know what? I'm staying home today and working remotely. So I'm at home. But if I may,
yes, please
just comment on a couple of things that are.
And Stella, lean into your microphone so we get a strong voice. Yeah.
Okay, great. Is that better?
I think so. Yeah.
Okay, I don't have an external mic, so it's
okay.
My mic. But Senator Hayden just hit on some really, really key points, and so first of all, we are seeing the increase in the domestic violence. We certainly, people that need a connection with mental health professionals or just family. He is so right. It is so important to remind family members and friends. We got to go back to old school of picking up the phone, connecting with people over the phone, connecting with them in the new age through Zoom video, because the isolation is one that impacts people's mental health, their social well-being, and all of that can really put people at risk for infection. So let's just be real, because when your mental health is impacted, that impacts your physical health. It does have an impact on your immune system. So we want to keep that in mind. The other thing is that we are doing mental health counseling over the phone. And so folks can call our call center, which is 612-543-2500. We have staff that are available. We are trying to make sure that we are there for people as they need it and be able to connect them. The other thing that I just wanted to comment on, because I too looked at the statistics on the Minnesota Department of Health website. They're a good resource to go to you go online and look, they will show you by county where the cases are. And you can see certainly Hennepin County, which is the largest county, has the largest number of cases. And they give you the breakdown by age. But what is the breakdown by race and ethnicity? So we, at Hennepin County, there is the, as I mentioned, the incident command structure. So I contacted Chad Cooper, who heads up our disparities reduction area for the county. And I asked him, I said, Chet, are we looking at this data? Are we looking at it, the race and ethnicity? And he told me, he says, yes. He said, we're collecting it, we're looking at it, our epidemiologists, our data analysts are looking at it. He said, but we want to make sure that we have the data correctly. And we both talked about how important it is that communities of color know particularly how health pandemics impacts them. We know the health disparities that are here in Minnesota, so we need not think that this corona virus is going to be any differently. And what I hear from people too often, they want to know, well, and there's rumors, so we need to dispel the rumors. Yes, it does impact Black people, it does impact communities of color. But if they don't see that, if they don't see themselves, then there's like a false narrative. And we want to make sure that that information is available so that communities then can protect themselves. They can communicate, because each community communicates differently.
Yeah.
And we want to make sure.
Stella, thank you. Go ahead, Harry.
No, I was going to say, to her point, in talking about making sure that there's a proper face to this disease and highlighting the disparities. We have been joined by Representative Bowen of Wisconsin, and he kind of knows firsthand of the direct impact. So we want to first welcome you to the conversation.
Absolutely. Thank you so much for having me.
Yes.
And so I saw you on CNN yesterday. Let me say you did an excellent job of capturing my attention, and I think the attention of all Americans and maybe people around the world who were riveted to the focus that you brought to examining the impact of COVID on citizens in general, but citizens of our communities in particular. And I wanted you to introduce what your picture is to our listeners on KFAI radio here in Minnesota, and our viewers on Facebook around this community and around the world. So thank you so much for taking time to talk about the Milwaukee. You represent District 10, I believe, which is North Milwaukee. And you said on TV that your audience, your constituency, is largely Black and Hmong. Can you describe that and describe your concerns?
Absolutely. So I represent one of the most diverse districts in the state of Wisconsin. It is essential that, even I am able to highlight the magnet that the virus is having to the north side of my district, where a majority working class African-American neighborhoods and communities live, Hmong neighborhoods live, and compared to the white middle class mansions on the lakefront, even some upper middle class folks that are white, that are dealing with the virus in different capacities and different dynamics. Right now, we're seeing the numbers. I contracted the virus about March 10th, and symptoms kicked in days after that. Got a call from the Shorewood Health Department, which is the suburb of my district, after I met with one of the local elected officials there. Came down with the symptoms, very intense for about 2 weeks. I literally am just being released from mandatory quarantine from the virus itself, but then also understanding that I'm not the only one in my community on the north side of the city that is dealing with this virus. We are seeing it continuing to grow at exponential numbers. From the day I started paying attention to how the numbers were growing, we literally had about 3 times that within a week, and within a 7-day time frame and span. Literally seeing people in our community that are left at a disadvantage. If it's anything that this virus is showing, it's showing how inadequate healthcare is for Black communities and communities of color. It's showing how inadequate the response is to get true information to folks in our community, to use voices from our community that we can trust, to be able to cut through the nonsense. I just heard from the last speaker, there's this notion that, that Black folks can't get the virus, or that this virus, is a hoax, and this literally came from the President of the United States, that fueled so much misinformation and people to take this lightly, including myself, where it was literally people were in my ear saying, oh, it's just the flu. And you get it, and then you realize, oh no, it is not just the flu. You're dealing with a virus that literally is wreaking havoc on your body. And if you are Black and you're dealing with the disparities of having more prone of having hypertension, diabetes, asthma, these things fuel this virus to be able to attack your body like no other. My own mentor, Leonard Wells, he moved down south. He came to Milwaukee to visit and contracted the virus and lost his life. 65-year-old man that served on the Milwaukee Police Department in leadership. He's been a former community host, radio host like you. He's impacted so many lives, and we will not have the chance to be able to have him in the community impacting us anymore. I've witnessed my own mentees from around the country that are dealing with losing loved ones and family members. Literally my mentee in Georgia, his father-in-law died in his arms, not being able to breathe. The effects of this virus was completely undersold to prepare people, especially in our community, that have pre-existing conditions, that don't have access to healthcare and a primary healthcare physician. And it's sold as it's just not that bad, when literally we're now seeing people lose their lives over this virus. So
Representative Bowen,
so there've been
you're also a young man. You're a young guy. You are very young.
33. Listen,
Yeah.
I am 33 years old. This virus has no preference whether you are old or young. And I think, we saw the videos of the young people out in, I think it's Cancun or wherever they were in Florida, or they were in West Palm Beach, and they were just out there kicking it, and they're just like, oh no, I don't care about this virus. I'm here to hang out. And literally they don't know how easily it is to contract it from person to person, how they can pass it on to somebody who has a immune deficiency disorder that puts their immune system at a disadvantage fighting this virus, and literally can put somebody in the position of possibly losing their life to
so Representative, walk us through your experience again. I think I'd read something about it, but what happened? You're going along your daily business, and you thought you had a cold. Tell us what happened, how it progressed, and what brought you to here. Just give us the steps and scenarios.
Sure. So essentially, I saw a fellow colleague that was elected on the local level in my district, saw him in a cafe, didn't even plan on meeting with him, sat down with him. We caught up, and literally because we are conversing so closely, that's how I contracted the virus. Had no idea he had it. He had no idea that he had it. And, I got a call a few days later. The symptoms start to kick in maybe 48 to 72 hours after that. And I'm thinking that it's the regular common cold, right? We all experience the chance where you might come down with some body chills, and you sweat it out, right? You sweat the virus, the flu out, and then it's just gone. But literally it just kept on lingering. The body aches just became worse. My body, I don't have a thermometer at this point, but I'm pretty my body's hot, but I don't know how hot I'm running, but I'm also feeling cold at the same time. I'm walking around my household with a winter hat on because I'm so cold, but my heat is on blast. I have a space heater, and my body's literally burning up at this point. By the time I get a thermometer, I'm up to 103 degrees. I finally get a call from the health department that I was in contact with somebody that was, I don't know if they could confirm directly that they had the virus at that point, but they know that they were in contact with somebody that had it. And I at that point was like, well, I think I might need to go see my doctor at this point. So my doctor's Nigerian. I go see my doctor on the, not too far, northwest side, northeast side of the city of Milwaukee. He gives me the test, and I don't know if anybody had the test run on them yet. They take this swab sample and they stick it like all the way up your nose. So it is kind of even intense just to get the test. So I get the test done, and my doctor's like, yeah, you have all the symptoms. We'll run the test for you. But it was even hard for them to get access to testing. They run the test 3 days later. It's actually confirmed I have the virus. And in my mind, I'm thinking like, man, this is the same virus that started on the other side of the world. How in the world is it really in my system? And I get prescribed cough medicine because there is no direct medicine at this point to be able to treat this virus. So the cough medicine helps somewhat, but the fever keeps going, the body chills and the aches keep going. You start the cough and the tightness in your lungs. And I'm so glad I don't have asthma, because I felt like if I had asthma, I would be at such a disadvantage. Trying to just be able to breathe on a regular basis, not to be in the struggle of in my own home, and just trying to, I had a humidifier, thankfully, to try to just like have some mixed moisture in the air. But it was tough. It was tough getting through about 2 weeks long of just those symptoms, and they finally started to subside, and I'm finally on the end of dealing with those symptoms now.
So glad for you. Let me ask both Stella Whitney West, CEO of North Point Health and Wellness, and Senator Jeff Hayden to weigh in here. But I'll tell you sort of a personal story that I think Jeff Hayden and I have talked that's important. So glad you're sharing your story. I have said that I'm at home and staying at home. My daughter brings by food and things that I need and leaves them on the back porch and lets me know she's here. When they drive off, I go out and get the stuff, and I bring the bottles in or the packages in and wipe them off, So I'm being very, very careful. It's because I'm 72 years old, number one. I have a recent experience with congestive heart failure. That puts me at risk. I've had a lifelong hypertension story, puts me at risk, and also am living with prostate cancer, right? In a way that's not, the diagnosis is simply to monitor it. But I think I'm a typical compromised person, so it really makes sense for me to be as careful as I can. Absolutely. And to not do things that out of my sense of machismo, right, that put me at risk and put other people at risk. And Senator Hayden and I were saying, it's wonderful that we as Black men and Black people have this public conversation. Absolutely. So we need to disabuse our community of the myth that we can't get it or that we can somehow dance around it. So Senator Hayden, respond, if you would, to these two personal stories at the policy level. Because we started off with Harry Colbert's story talking about the question of health disparities. Our neighborhood, your district, where Stella and I, where I live and Stella works, District 59 in North Minneapolis, is a neighborhood that has the health disparities that typically affect Black and brown communities all over the country. What in public policy does this mean? What can and should we be doing?
Well, first of all, thank you, Al, and thank you, Representative Bowen. Tell Senator Taylor I said hello, and the Lieutenant Governor. They're good friends of mine, and I'm glad. Thank you for your service. I
Thank
really
you.
appreciate it. Like us all, I've had childhood asthma. It doesn't flare up much. However, it can become seasonal. I have hypertension, right? I'm working hard to lose a little bit of weight, like the rest of us. So, I'm 53 years old. So, I'm in the hot zone like everybody else. And so I think it's important for us to share that. And Representative Bowen, thank you so much for your just really crystallizing. And I'm hoping that when people see it and they see a African-American man, a handsome one, accomplishes you, that says that, hey, you're not invincible, because we do walk around sometimes just by the way in which we have to get along in society. We kind of have this invincible kind of feel that we put on just to kind of get along. And this virus, this germ, doesn't care about that. You're not an immortal. You're not a Marvel hero, comic book hero. You can get this virus, so it's important. Let me speak to the policy a little bit. So in Minnesota, we have some of the greatest disparities in the country, but we have one of the best. The difference is we have one of the best healthcare systems in the country, but we still have an issue in the African American and Somali community, in particular, American Indian community. So there's a real disconnect for us. So unlike in your state, a representative, where you had a regressive governor that kind of dismantled a lot of those systems, and you're starting to put them together, we didn't have that problem. We had a surplus before this happens. We have 8 great health systems. We have a very robust FQHC system that CEO Sister Stella Whitney West is a CEO of one of them, and we have a great network and we work well. So for us, it's a lot about this communication. It's a lot about having the conversation. It's not just access. It's making sure that it's culturally appropriate and relevant. We had this on the Black women's maternal conversation. So we have a lot of access. We did early Medicaid the day it came out, right? So we have a BHP or Minnesota Care program that takes care of people, working class people, and then we have a robust exchange. So in the medical, community, we should be fine, except for we don't do it very well from the context of culturally appropriate and culturally specific. So once again, I want to applaud your story and your ability. I was just looking you up to tell this story and for it to resonate around the country. And then the backbone is people like Stella and North Point Wellness and others that can speak to this from a cultural perspective to make sure that people are doing the things that they're supposed to be doing. We're engaging the Black pastors in other communities. Al, specifically, from a public policy perspective, we have appropriated over $350 million to fight this issue, with a good amount of that money that is supposed to go to community outreach, supposed to go to the FQHCs, supposed to be able to get to the media organizations like yourself to get this out. So what we're struggling right now is we're moving at the speed of bureaucracy inside of government. And those of you who understand that mean that we're not moving as quickly as the community needs it to be had. So what we need is really for us, and what we're doing is really pushing the bureaucracy to get those resources, that money. The churches are doing their own kind of version of Meals on Wheels. That should be accompanied with information that tells them about this disease. And then that should be also accompanied with a phone number that we can check on you if you're a senior and you're isolated. And this isolation with seniors is different because we're asking people not to visit their folks. I mean, they can visit and say hi, wave out the window, but we're kind of telling them to go, don't check on mama, but don't check on her the way you used to check on her. You can't necessarily cook for mama the way you used to. So we need to be able to figure that out in our Black clergy, our Islamic centers, imams and others in the Hmong community. They've been experiencing a lot of racism. So we're really starting to work on this issue in a way that is different. But our challenge here is not resources in Minnesota. Our challenge is getting the bureaucracy, those that work inside of the system, getting the nonprofit sector and the philanthropists to really focus in on those communities and make them a priority. What we're essentially doing is what we've always done, which is to kind of give it to these big entities, and I don't want to slight them at all, but there's a whole group of people that miss. And the data suggests that we have the greatest health disparities or the greatest education disparities in the country. But that's if you disaggregate the data. But if you aggregate it, we got the best healthcare in the country and the best education. So for us, we have to have this conversation that's disaggregated, that's targeted, that's smart. And we need to make sure that, for instance, Insight News and all of our other ethnic news programs, BMA and Spokesman Recorder and others, that they're well resourced so that we don't just have 3 people here, that we can have the capacity of a town hall of 100 people, that we can get out into the airways in the same way that the big commercial stations do. That's what we need to do to be able to stop this. So once again, ours is not resources, ours is not access. I mean, yeah, we have some problems, but right now, hopefully we have enough beds and we have a lot of ventilators, and we're still working with the PPE because it hasn't spiked in our community, but we're on track to get a lot of that. The problem is if we can bend the curve on the disease, if we can get the information out so people know that, look, you can't go to lunch right now with your friend, because if you do, you're gonna end up like my good friend Rep Bowen, who didn't know at the time what was going on, and you're going to get it. Just because you're an elected official, just because you're young, just because you're handsome, it doesn't mean that you're not going to get it. And that's the conversation we need to have that goes beyond the appropriation and the overarching policy.
Representative Bowen, jump in again to respond if you would.
Yeah, it's so interesting that our brother Representative Hayden and
Senator Hayden.
Yeah, just Senator Hayden, just to the west of us, we have different parallel political histories ever since 2010. Literally, our state went complete GOP, Republican control. Minnesota went the opposite, and then they actually were able to have some control, either split or full control on their side. And we've seen absolutely the dismantling of investments that should have been made in especially public health. We did not take the Medicaid expansion like our neighbors in Minnesota. A lot of the resources that would be there to provide health care for individuals, especially in our community that can't afford it, that are low income, that are working class, that have been given the short end of the stick when it comes to healthcare for decades, they would have benefited the most. So we literally are in 2 different boats. It's like the curve what you guys are experiencing is being leveled, and you are very slow in your growth, and ours is just climbing up very high, very quickly. And it's impacting our healthcare system for sure. I know folks in the healthcare industry here that are running out of gear, that are dealing with so many, there's so many people that want to get tested right now that can't. And literally, we have folks in our community that are just being told to assume that they have the virus without actually being tested for it. It is—
Representative, let me ask you, so how does the urgency, the immediacy, and the pervasiveness and the potential devastation that COVID-19 represents, how does that change the game in terms of demanding that our legislatures and our society earnestly address this question of health care disparities? Because on the one hand, we've been championing awareness of the impact of health disparities, but often in an environment that includes a lot of people that, turn a deaf ear, and it's not a priority, but they are being impacted as we are being impacted. We may be more than they. Does this create an opportunity to educate and to change, to reform public policy in a way that advantages and levels the playing field for our people? What do you think?
I think it does, because it's exposing so much of disparities. There are folks in our community that are working low-wage jobs right now that are trying to support their families. They are risking their well-being, their health, especially with a slowdown economy, trying to provide money for the rent or their mortgage, to keep food on the table. They are in a very tough position because at this point, they literally have to choose between being able to provide or, just staying home. And, there's a lot of uncertainty. Those resources are not there right now from the federal government to be able to make sure everybody is okay economically. We still have to wait on that. Right now, there are a lot of people that are outside of our community that get to work from home. Really think about it. They don't have to go anywhere. They don't have to risk their livelihoods or their well-being. Folks in our community most likely have jobs where they have to interact with a lot of people, or they have to interact with the public. They're doing things outside that just can't be done in the service industry right now. So we are trying to work as much as possible to make sure they're at least in a working position where they don't have to be in a position without the proper gear, without the proper instructions to be able to do their job safely and not bring the virus back home to where they live. We know that our folks in our community are living in multi-generational homes. There are 5 people living in a 2-bedroom apartment, especially with the housing crisis that we have here, and not enough adequate housing. So people are living together. You can't socially distance with that many people in a small space. We also know that, the investments that we should have made here for our communities to have access to healthcare, to be able to engage African-American men that are used to going to the doctor outside of emergency services or urgent care services, right? When things are too late, when things are very bad, we know that we need to have those initiatives and those resources there. And now I believe it will put pressure to make sure that those things are there in the future.
Stella Whitney West, let me ask you to sort of describe how we have to, as individuals and community, take responsibility. What is the role? What's the mission for ordinary men and women in our neighborhoods? What is our role in this fight?
Well, we have a significant role. All of us do, and I'm going to say one of the things that, if nothing else changes for us, for our community, we need to understand about how resources flow into our community. So let's not forget, even though all of the news right now, rightfully so, is on the COVID-19, let's not forget the census. When we fill out the census and we encourage friends, family, everyone to fill out the census, that has an enormous impact on resources that flow into our communities. So we do not want to be undercounted, right? And the same thing when it comes down to casting our vote. We all see what happens when you don't vote, all right? So if I may, I just want to comment on one of the things that the Representative Bowen said. And thank you so much for sharing your story. One of the important things that he talked about was the fact that he was contacted by the health department. And that's why testing is so important. And it is really a travesty that there's not the availability of testing for everyone, certainly for those who present even with symptoms, because there is not adequate supply. If we are going to eradicate and stem the tide on this virus, people have to know if they have it. And it's important because what happens when you get tested, the state health department then kicks in and they notify people. They do contact, and they will check to see who you have been in contact with. And then they will contact those folks to let them know they have been in contact with someone who tested positive, and then what they need to do. And if you don't get those kinds of calls, if you don't get that action, then there are people walking around, just like the Representative Bowen said, who thought that he just had a cold. And so then if you're operating on the fact that you think that you just have a cold, you're not protecting other people from being infected. So we need to be sounding the drums that there is no excuse why in this country that we do not have adequate testing. You look at countries, you look at Singapore, other countries that have less resources, They're testing everybody. That is something that we need to be shouting out. There are people that want to be tested, and they can't be tested because there's, in order to preserve the limited supply of test materials that we have, they're only testing those that are at the highest risk. So that's—
Let me say thanks to all of my participants. And let the station know we'll wrap up in 30 seconds or in 45 seconds so that we can switch back to state regular programming. I'm Al McFarland. This is Conversations with Al McFarland, a special program, not only a radio broadcast here on KFAI, but also a video stream, live streaming to Facebook at Insight Facebook. If you like this, we ask you to like it and to share it. We want to continue with this style of using technology to connect our community, both using broadcast and webcast and podcast. So this has been a wonderful demonstration of that capability. Thanks to Harry Colbert at Insight, our managing editor, for facilitating this. Thanks to Representative Bowen, Representative David Bowen from the 10th District of the Wisconsin State Legislature. Thanks to Senator Jeff Hayden, representing Senate District 51 here in Minnesota. And thanks to all of you. Thanks to our colleagues at KFAI for facilitating this as well. Stay tuned for Lady J and Songs of the Soul, and be sure to join us again next week for Conversations with Al McFarland. Keep watching the Insight News Facebook page, because we're going to be doing streams like this every day, 7 days a week, we hope, certainly 5 days a week. We think it's important to keep our people connected. To all my guests, again, thank you so much. I'm Al McFarland.
Thank you so much, Al.
Conversations with Al McFarland. And we'll return to the station.